Do you hear that? Listen to that sound. Sounds like whooshing, almost like the rhythm of a heartbeat. In this video, I'm going to explain the complete guide to pulsatile tinnitus. Pulsatile tinnitus is a medical condition where you hear sounds coming from what sounds like your ear or your head that are related to the heartbeat or the rhythm of your cardiovascular system. Pulsatile tinnitus is not always caused from the ear, so then where does it come from? My name is Ben Thompson, audiologist in California and founder of Pure Tinnitus. In this video, I'm going to explain 7 potential causes of pulsatile tinnitus and some different treatment options. This is Pure Tinnitus. Hi, my name is Ben Thompson, audiologist in California and founder of Pure Tinnitus. In this video, I'm going to explain the complete guide to pulsatile tinnitus. I will explain the different symptoms of pulsatile tinnitus, 7 potential causes, and the various treatment options that can help you try to reduce that noise that you're hearing throughout your day and in the nights when you're trying to fall asleep. Pulsatile tinnitus is a medical condition where you hear noises coming from somewhere in your ear, your head, or your body that are synchronized with your heartbeat. So the pulse is why we use the term pulsatile for pulsatile tinnitus. Sometimes it can sound like a whooshing noise or a swooshing noise, and it has some rhythm, some natural fluctuations to it. Typically it's louder in a quiet place where there's not other noises to distract us from. Pulsatile tinnitus is usually perceived just in one ear, what's called unilaterally, and it's not the most common type of tinnitus. Most common type of tinnitus would be a high-pitched ringing or a buzzing sound in the ears, but pulsatile tinnitus is less common and is distinctly different. Fortunately, in about 70% of cases of pulsatile tinnitus, the medical team can diagnose the cause and treat it effectively. The medical team typically consists of your primary doctor, a ear, nose, throat doctor, a neurologist, and sometimes a cardiologist as well. So let's talk about pulsatile tinnitus symptoms. The first symptom is that you consistently hear a noise in your ear that seems to match the fluctuation of your heartbeat. This could sound like a whooshing, or this could sound actually more like a pulsing heartbeat sensation. It's also common to feel headaches and lightheadedness because oftentimes pulsatile tinnitus is related to a cardiovascular condition that's going on in their body. It's common to think that the cause of pulsatile tinnitus is in your ear because that's where you're hearing it after all. The diagnosis of pulsatile tinnitus typically comes from a few tests. First, a hearing test, then potentially an MRI or a CT imaging study, and then also potentially some blood tests to help understand the relationship between the cardiovascular system and your ear where you're perceiving the sound of the tinnitus. Some important questions we want to ask when we're considering the different symptoms of pulsatile tinnitus are, do you also have vertigo, dizziness, ear pain, hearing loss? If any of those are true, then your condition may be related more to your ear than your cardiovascular system. So getting a hearing test and speaking with your doctor is really all you need to do to make sure your problem is not related to the ear versus some other form of pulsatile tinnitus. Okay, let's talk about the different causes of pulsatile tinnitus. I found 7 examples of potential causes, so if you've already gone to different doctors and you're still wondering what's going to be the cause of your pulsatile tinnitus, this may help you. Of course, trusting your doctors is important, and if you're not sure if your doctor is qualified, then go to a large medical center in a city where they have more experience and they see more number of these kinds of cases. That will be in your best interest. A lot of these causes are related to cardiovascular conditions. So cardiovascular essentially means the flow of blood either from the heart to other parts of the body or from parts of the body, like our ears, to the heart. So it goes out and it comes in. The first cause could be abnormal vascular conditions that are affecting the membranous layers covering the brain. The second potential cause could be irregular blood vessels, specifically in the carotid artery, which is the pathway that blood travels from your heart to your head through this part of your neck called the carotid artery. Some kinds of pulsatile tinnitus in both ears can be caused by pressure on myofascial points in the neck or the face. Sometimes different trigger points in the muscles can cause the pulsatile tinnitus. Also, specific eye movements can trigger it, as well as certain muscle contractions of the neck or the jaw. The fourth potential cause could be a growth in the hearing system. This is some sort of abnormal condition where part of the eardrum space or the hearing organ or the hearing nerve has some sort of physical cause to the pulsatile tinnitus, and that would be identified by the different imaging studies your doctors would order. The fifth potential cause could be an inner ear condition called a canal dehiscence, and that's related to the vestibular function of the inner ear. The sixth potential cause could be intracranial pressure inside of your head caused by the veins that are designed to bring used blood back from the head into the heart. And the seventh potential cause of pulsatile tinnitus that I want to share with you is called a patulous eustachian tube. The eustachian tube is a passageway that connects from behind our throat up to near the nose and behind the eardrum. So when I blow out, that's sending air through my eustachian tube to pop my eardrums. Sometimes people can have a eustachian tube that remains open because naturally it should be closed when it's not blowing air through, and that can lead to a perception of a pulsatile tinnitus as well. So we just covered different potential causes of pulsatile tinnitus. Of course, there could be more. The only way you're really going to know is by working with your medical team to help diagnose this. But I wanted to give you those to get you on the right track and to help you understand what could possibly be going on. Now let's talk about different treatment options for pulsatile tinnitus. The effectiveness of treatment really depends on the cause, and like we just discussed, there could be different causes of your pulsatile tinnitus. If you're working with the right kind of doctors who know what they're doing, once they actually diagnose what's going on and they treat it, the pulsatile tinnitus, the sound, it should go nearly away or completely away. Your treatment may involve medication, it may involve changes to your diet or exercise habits. Also, it may involve a surgical procedure to remove some kind of physical object or to repair some physical structure in your system, whether that's in your ear, that hearing pathway, some part of the area around the head, the membranes around the brain, or some form of your cardiovascular health. If your problems with pulsatile tinnitus continue on even after you've worked with a talented medical team, there's a few things you can do. Number one would be get a second opinion by a different medical center. And I recommend going to a big city. Finding a city that has a clinic devoted to pulsatile tinnitus would be excellent. So go online to try to search that. Additionally, if you're still left with your symptom, then it's advised to work with an audiologist like myself, for example, who can focus on sound therapy and tinnitus therapy, where we can work on the neural pathways to try to reduce the sensitivity of the sound itself. Well, I hope this helps you learn more about your pulsatile tinnitus. Press that red subscribe button to learn more about tinnitus and hearing conditions. My name is Ben Thompson, your host. I want to introduce you to this next video, which will be by my side. This video is all about sound therapy for tinnitus management. So this may be helpful if you have pulsatile tinnitus right now and you need some relief, or if you still have pulsatile tinnitus and you're looking for sound therapy to use to help manage your tinnitus during the day and at night. So check this video to my side, guys. Thanks again for being here. See you soon.